Good afternoon, Rustin Langer. My name is Mihiraa. Let's start the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Importance of communication in nursing.
Communication in nursing is the exchange of information, thoughts, or feelings between nurses and patients, as well as among nurses and other healthcare professionals. Communication is important in nursing because it facilitates the delivery of quality care and builds trust and rapport. Communication also helps nurses to ensure patient safety by verifying information, reporting changes, and following protocols.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Your preparation time is over. You can now start your role play.
Hi Mihiraa, I'm Nurse Rustin. I know you've been through a lot today, and I want to make sure you're feeling okay. How are you holding up after the stitches?
It's been a rough day, but I'm managing. My leg's still a bit sore though.
I can imagine. It's completely normal to feel sore after what you've been through. Mihiraa, I'm here to make sure everything is all set before you leave and to guide you through how to care for your wound at home so that it heals properly. Does that sound good?
Yeah, that sounds good. I want to make sure I do everything right.
That's exactly what I like to hear. So, I would like to know your understanding about wound care. Have you ever taken care of a wound like this before, or is this your first time?
This is my first time with something like this. I'm a bit nervous, to be honest.
It's completely understandable to feel nervous, but don't worry, I'm here to walk you through everything. Mihiraa, I know you're probably eager to get back to your usual routine, especially with football. But to make sure your wound heals properly, there are a few important things I need to explain about your care at home. First, it's really important to keep your wound clean and dry. This helps prevent any infection and gives your leg the best chance to heal quickly. If, for any reason, the dressing gets wet, you'll need to change it right away to a clean, dry one. This might seem like a lot, but it's essential for your recovery. I also need to ask you to avoid playing football or doing anything strenuous for a while. I know that's probably the last thing you want to hear, but giving your leg time to heal without extra strain is crucial. Do you have any questions so far?
No, staying without practice will affect my performance this season. I'll just keep it clean and dry. Anything else I need to do?
Mihiraa, I completely understand how important your practice is, especially with the season underway. It's frustrating to have to take a break when you're focused on your performance. But the thing is, your body needs time to heal properly, especially in the first few days after an injury like this. Taking extra care right now is crucial because it's during this time that your wound is most vulnerable. If the wound opens up or gets infected, it could cause more serious problems and actually keep you out of practice for even longer. I know it's tough, but giving your leg this time to heal will help you get back to your full strength more quickly. One thing that might help during this time is using a sling. It can reduce swelling and protect your leg, reminding you to be careful with it. It's not a requirement, but it's something that can really support your healing process. Your body needs this time to fully recover, and the more you take care now, the sooner you'll be back on the field.
Okay, I'll try to stay off it. What should I look out for to know if something's wrong?
That's a great question. Mihiraa, I want to reassure you that we've taken all the necessary steps to protect your wound from infection. We've started you on a course of antibiotics, which is a strong safeguard against any potential issues. The wound treatment you received was thorough, and the stitches are secure. However, it's still important to keep an eye on the area as you heal. There are a few signs of infection you should watch for, just to be safe. If you notice any increased swelling, more pain or heat around the wound, or any leakage of pus, those could be signs that the wound isn't healing as it should. If any of these things happen, please reach out to us right away so we can address it quickly. As for the stitches, they'll need to be removed after about 7 days. It's a simple, quick procedure that we'll take care of here. We'll make sure the wound has healed properly before the stitches come out, and you'll be back on your feet in no time.
Got it. I'll keep an eye on it. But why couldn't dissolvable stitches have been used so I could have avoided a follow-up hospital visit?
I understand why you prefer not to have to come back for a follow-up, Mihiraa. It's completely normal to want to avoid extra hospital visits. The reason we used non-dissolvable stitches in your case is because of the depth and nature of your wound. Non-dissolvable stitches are stronger and more secure, which is particularly important for deeper wounds like yours. They help ensure that the wound stays closed properly as it heals from the inside out. Using these stitches gives your leg the best chance to heal without complications. While I know it's a bit of an inconvenience to come back for removal, it's really a crucial step in making sure everything heals correctly and you're back on the field as soon as possible. Your safety and full recovery are our top priorities, and this was the best option for that.
Okay, I got it.
Excellent. Mihiraa, how are you feeling about going home and taking care of everything on your own?
I feel a bit better now that I know what to do. I think I'm ready to head home.
That's great to hear. Take it easy, focus on healing, and you'll be back on your feet in no time. Take care, Mihiraa.